Hi, everybody. My name is Dr. Ilana Gurvich. I'm a naturopathic physician and a neural therapist, and I'm really excited to launch this podcast with my co host, Dr. Ann Hill. Today, I just want to dive into getting to know Dr. Hill, how she got started with neural therapy, what is neural therapy. And so we're just going to spend the entire episode just talking about her. Dr. Hill, can you introduce yourselves and what you do and how you do it?
Okay, so as you stated, my name is Dr. Ann Hill. I am a naturopathic physician. And before that, I was an herbalist and a craniosacral therapist. And I brought that into my naturopathic medical education. And once I became a naturopath, I decided to learn neural therapy. And that's kind of why we're here today, because that became a great passion of mine in my practice. And I see it change so many patients' lives. I went through the,
You get into medicine.
oh, well, let's back up for 1 minute. I got into doing herbalism because I lived in New York City and I realized I was dependent on humans for everything, and I had no idea how to grow my own food, build my own shelter. I really was realizing like I wanted to learn that stuff. So I ended up moving to New Mexico, which was an amazing experience. And I learned how to grow food. I worked on a ranch where we grew organic food, and I worked at a farmers market for them selling their food, and I started learning herbal medicine. And I basically, it was definitely kismet because two of the biggest herbalists were in New Mexico at the time, Dr. Tieraona Low Dog and Michael Moore. And so I studied with them for several years. And then I set up my practice as an herbalist. But then I started realizing, oh, I really like working with people, but I don't know enough about medicine. So then I looked for a medical program to do. And I was trying to decide between MD or, being a nurse practitioner. And then I had learned at that time, I did not even know this existed, but I learned about naturopathic medicine and naturopathic medical schools. And I realized, oh, that's kind of exactly what I want to do. So, so I ended up applying to, at the time it was NCNM or NUNM. No, it was NCNM at the time. Now it's NUNM, which is our naturopathic medical school in Portland. And I moved to Portland and went through that program and have been a naturopath ever since. So,
At the time, were Michael Moore and Dr. Low Dog teaching together, or you went through separate trainings with each of them?
so the funny thing is, so there was one herb store in Albuquerque, New Mexico, and the woman who owned the herb store also owned this like other building where their offices were, and Michael Moore and Tieraona Low Dog both had their offices in that same building. So I found out about Tieraona, and I really wanted to study with her. I mean, she's a super dynamic, human with lots of, um, she's just got so much energy and so much passion for herbal medicine. So I started studying with her. And then when I would go into my classes, I would hear about all these other students and I would talk to them because they were studying with Michael. And I realized there were two very different people approach herbalism really differently. And so I was like, okay, well, I want to study with Michael too. And by that point, I had owned several of Michael's books because they kind of specialized in plants of the Southwest and the mountain Southwest. And so I was already out like hunting for herbs, like in the wild, and I was like, oh, okay, I want to study with this guy too. So it was really definitely kismet that they were both there at that time. And shortly after I studied with them, I think Tirona had gotten her medical degree and was off doing her residency, and I think moved to Arizona. And Michael ended up moving down to Arizona, Bisbee, Arizona. So they really were only there for this short time that I happened to be there as well. So it's very, very fortunate.
And so you studied with her before, because I've heard her speak at conferences. She's a very dynamic speaker. I didn't realize she was an herbalist first and then went on to become her MD.
Well, yeah, no, she was an herbalist. I think she had a grandfather that she studied with because she's from the Lakota tradition. And so he taught her a lot. And she was basically just working. I don't know if she had a massage therapy degree and she also blended the herbalism into that, but that is what was her instigator for getting into medicine. And then she really realized, this needs to be more mainstream. It's kind of ridiculous that it's, this herbal medicine is like this antiquated thing that nobody nobody pays any attention to because it's so important and it works so well for people. So
How many years did you spend doing that?
I studied with her for a couple years and with Michael for at least a year, if not a little bit more.
So you were down in New Mexico for 3 or 4 years total.
Well, so then the other thing I did is I studied with Dr. Lad, who is Ayurvedic uh, practitioner. There was a lot of Ayurvedic medicine happening in Albuquerque at that time. A ton of herbalists were learning Ayurvedic medicine. I really was very interested in that because of the detoxification protocols and things like that that aren't really as much standardized in Western herbal medicine, at least our American Western herbal medicine. And so I studied with him, and then I worked for a couple of years just getting my prereqs to get into naturopathic medical school. So I was there for a total of 5 years.
And then the other thing that I think is also as important to talk about historically with your practices, you do a lot of hands-on orthopedic stuff, especially cranial sacral. How did you get into that before
Okay.
we talk about neural therapy? Because I feel like one of my favorite parts about teaching with you is you really weave in the cranial with like this very, very gentle hands-on modality with the injection protocols. How did you get into that?
Okay, more kismet. I always tell people all my teachers were in New Mexico. And then I came to Portland to just get my degree. So my other teacher was Robert Stevens, and he ran the New Mexico School of Natural Therapeutics. And he taught something that it basically came out of the craniosacral tradition, and he calls it core synchronism. So I studied core synchronism with him, and a lot of it was really blending craniosacral therapy with polarity therapy. And polarity therapy is there's not a lot of people practicing polarity therapy, but polarity therapy was from a doctor named Dr. Randolph Stone. He was a chiropractic physician who traveled to India and was very into like kind of more esoteric techniques and really looked at energetic medicine. He looked at, like with Chinese medicine, we have we have wood, fire, air, water. Like we look at things on kind of an energetic level and how things connect. And so Dr. Randolph Stone sort of pulled in sort of the more traditional Indian um, thought process around that and how all the different parts of the body are related to air, ether, fire, water, and how you can connect the parts of the body. And that if there's two organs that are related to ether and they're having pathology, you want to connect those organs and make sure that they're working properly together. So core synchronism was pretty amazing, and I really enjoyed studying that. So when I started my practice, I actually started doing uh, core synchronism and herbalism, but I mostly just kind of describe it as cranial because almost nobody knows what core synchronism is. It's very like endemic to the area, but not necessarily to the rest of the U.S. So yeah.
So then fast forward us, how did you get involved in neural therapy? How did you get introduced to that?
Yeah. So my favorite story from when I was in the clinics at NUNM was there was a guy who came in. And so the clinics are, everybody goes through, obviously having to be a primary caregiver in our practicum, in our clinics for naturopathic medicine. And so we see lots and lots of different people. So there was a guy who came in and he was a chef. And he was coming in complaining of bilateral tendinitis in his hands and his arms. And of course, this is because he's a chef and he grabs onto large, heavy pots and has to flip things all day long. And he said to me, "Do you guys do prolotherapy?" And I was like, "No, I don't even know what that is." And he said, "Oh, I saw this doctor down in Ashland, Oregon, who did prolotherapy on my arms, and I have not had pain for 7 years, and the pain's starting to come back again." And I was like, "Oh my gosh, I have to learn this." Now, we don't teach any injection therapies in our programs at school, as you know. So it had always sort of been in my brain, like, I really want to learn prolotherapy. But when I got out of school was also when I got married and I was having kids and I didn't have a lot of time to like learn new things. because I was getting my practice together, learning how to just treat the basics, right? And then when I finally had time to do some extra work, I got an email from a colleague of ours who was like, "Oh, this guy's teaching neural therapy, neural injection therapy." And I was like, "I don't know what that is." So I looked it up and it sounded pretty amazing because what I was reading about it was that it was not just treating pain, but that it was also treating mental emotional dysfunction and, basically through treating the autonomic nervous system. And so I was like, okay, well, I need to get some, continuing education credits. And this person's coming to town and I'm going to go ahead and do this seminar. And honestly, I was completely hooked. Like I did, I went through, it was a 3-day seminar and, it took me a while to integrate it into my practice, but it was literally like the very first person that I just experimented on. It actually worked. And so then I was like kind of hooked from there. So that's how I got into it.
Okay, I mean, I don't think that's that dissimilar out of a lot of people how we got into it. Can you kind of break it down since we're just introducing this concept? Can you break down what is neural therapy and maybe can you break it down in the context of of a patient that you saw that really allowed the therapeutic to shine?
Yeah, I mean, there's thinking about the questions that, we want to ask the people that we're going to be interviewing on this podcast. And I was like, there's just so many cases. But of course, the most, interesting case to me is the one that I just saw last week. So um and is the freshest in my mind. So neural therapy is treating the autonomic nervous system and is basically facilitating the nerves to start working better. Now, why do the nerves not work well? They don't work well because there's been chronic inflammation, there's adhesions, there's scar tissue, there are environmental toxins, there are chronic infections, things like that. So, all of these things basically prevent the nervous system from functioning properly. And the function really of the nervous system is just to be able to send signals. And we know this through studies that have been done on scar tissues that the when the nerves aren't functioning properly, they don't have enough energy to create an action potential. And that's for any of you who have had, neurology and in your studies know this, that action potential is basically how the nerves are able to send signals. So the action potential in many nerves is blunted or it's not working properly with scar tissue adhesions and chronic inflammation in the system. So when I talk to my patients about it, I tell them that it's a little bit like when your computer is fritzing out and it's not working very well. It's because you just need to reset your computer. And that is what Procaine is. It's sort of that computer reset that we utilize in neural therapy. So Procaine hyperpolarizes the nerves, which means it helps to reset that action potential to bring it back to the electrical voltage that it needs to be able to send the signal down through the nerve. So when it does that, it is able to help bring oxygen and nutrients and function back to areas of the body that have not been working well because these areas have been under chronic inflammatory stress. And what I love about my background in Ayurvedic medicine is in Sanskrit, they call when they're talking about detoxification, they call waste products in the body ama, AMA. And that's the Sanskrit term. And they don't ever distinguish between whether it's a waste product that is from a mental emotional issue or from a physical issue that's happened in the body. So that's kind of what I love about it is when we're utilizing neural therapy, we are able to help facilitate release of not only physical trauma to the tissues, but also mental emotional trauma. So my favorite case from last week was I had a patient who is a 70 to 73-year-old female. She was referred to me specifically for neural therapy from another provider in town. And she had 2 C-sections and hysterectomy. And it was a horizontal scar. So there's different types of scars now because sometimes they do different things, with laparoscopic surgery, but it was a horizontal scar. They did all three surgeries through the exact same scar. So it was a pretty mean looking, angry scar. It was very red, very indurated, meaning like super tight and tough. She's older, so she hadn't actually seen the scar in years because she had gained a little bit of weight, so her belly was sort of hanging over the scar. She'd never actually really looked at it. So we did the first treatment, and I warned her, as I always do with my patients. I said, "Well, you might feel a mental emotional release, and that's okay. That can happen. And if it doesn't happen, that doesn't mean it hasn't worked because we know we're treating the scar tissue and helping to just even release any adhesions from that." And so when she came back in this last week, she said, "I was really glad that you told me about the release." Because she said, after we did the scar tissue, after about 3 days, I suddenly went into this high anxiety. But because you talked to me about that, I realized this is the kind of anxiety that I felt during that time period when I was having the C-sections and and having to get the hysterectomy. And so she said it lasted about 4 or 5 hours, and she just called a friend and talked about it, and then it was gone. And so that we talked about it, this last week, and she said I was really glad that whatever that was able to just move out of my body and leave my body. My body's not holding on to that trauma anymore. So yeah, that was one of my favorites this last week.
So we're in the US. Can you explain to people how we get trained as neurotherapists in the US?
Great question. From us, we started teaching it because we have been so inspired, obviously, from our case histories and the patients that we've treated. There's also the North American Academy of Neural Therapy, and while they don't do trainings, there's at least one other person on there that does trainings in the U.S. There are several people also, I think, in Canada doing trainings as well. So while there's not a lot of us, it is, it's something that's definitely worthwhile looking into. It's what we know of is, and you in particular, Alana, because you studied with a lot of the European neural therapists. So right now, it's kind of one of those things that's much larger in Europe and in Latin America. In Latin America, there's many of the countries you actually study neural therapy after you get out of medical school. And Colombia in particular, I think is like a 2-year training that they do, from what I recall, speaking with Colombian neural therapists. And a lot of the doctors there will just specialize in neural therapy and do neural therapy with their patients. So
What is your favorite? I think us as any neurotherapist, I think definitely has like their favorite injection, like the injection that they default to because it makes the most profound difference with patients time and again. What is your favorite injection?
okay, well, I'm going to give you two because
No, just one.
no, I want to give you. Okay, so there's acute and then there's
Uh-huh.
chronic,
Okay.
right? So I would say for my chronic patients, my female patients who have had C-sections, who have had issues after the C-sections, I would have to say my favorite with that is actually doing their C-section scar because it's just made such a humongous difference for my female patients for sexual dysfunction, for chronic pain in the pelvic area, for chronic urinary tract infections, for a lot of my female patients have said exactly the same thing that it's not like they're talking to one another because they don't know one another, and they've said, I just don't feel connected to myself after about like where that C-section scar is. So on an energetic and a physical level, it's made a huge difference for my patients.
And
And
then
then
what
for
for acute?
acute,
Yep.
go ahead.
Nope. For acutes, what's your favorite for acutes?
My favorite for acutes is it's not the funnest injection, but for chronic and acute sinusitis, we do a sinus treatment. And the one that I like to do that, like I said, is not the funnest, but it's quick and fast, and people ask for it again and again. So I know it's worth it for them to come back. But we do small injections kind of around the sinus area, and then I also put ozone in those injections that I would say probably 95% of the time treats, maybe even more, treats acute sinusitis. And for chronic sinusitis, we tend to have to do it a few more times. But I've had chronic sinusitis completely clear up from that injection. So I just love that one.
It's interesting because I don't think either one of those are on my list.
Well,
Yeah, I mean, that is what makes, neural therapists have first of all, they have a praxis specialty. Second of all, they get into a rut where they do their injections that they're really familiar with, and that's what they go back to again and again.
right.
That's
Yep.
interesting. And then can you um can you build us a picture about how you pair the injections with the cranial? Can you explain to us in your practice how that works?
Yeah. So typically what I'll do is I will do when I'm, taking someone's case history, and I see either patients who have been referred just to get neural, or I have my patients that are just my patients. And so when we're talking about doing different, neural injections and things like that, I'll kind of like come up with a plan. And so one of the main plans for all these patients is really what we're going to do is we're going to do neural therapy first because that's the kind of painful, yucky stuff. um, the procaine is a sympatholytic. So the instant that the procaine gets into the body, it actually helps our patients get into that parasympathetic state. So then I want them to just be able to rest and relax and after we're done with the injections, then I'll usually do some craniosacral therapy. Now, I had another patient this week who came in. She was coming in after having a thyroid removal scar injection being done. The first time she had this done was several months ago. And it was it actually brought her right back into the operating room. She said literally she could see the operating room lights and she felt like she couldn't breathe. She went into kind of a really hyper state for a moment until her whole body was able to relax. So she came back for us to do this again. And so it's really nice to be able to do that injection. And then I had not done cranial with her before. And I just said, is it okay if I do a little cranial with you after the injections? And she said, yeah, because we had already done the protein. And she said, I could definitely feel like there's a lot of release happening in my body right now. And I definitely feel like when you are doing hands-on body work with people, it helps to ground people. So when they're doing detoxing or releasing of like kind of more mental emotional states that are stuck in our tissues, when you even just put your hands on somebody in a deep listening way, it can really help facilitate that movement and that release. So I was able to do that with her for like the last, 10 or 15 minutes of our appointment.
What percentage of your patients are you doing that with?
I would say probably about 70%. Yeah. I mean, there's a lot of patients that just come in for quick injections that we're doing teeth or things like that. So I'm not necessarily focusing on that. But a lot of people have more complicated case histories. So I'd say probably the majority of them. Yeah.
And you notice that gives them some time to integrate?
Yeah, absolutely. If especially with the larger amount of protein where people are, kind of going into more of that parasympathetic state and we're keeping them on the table, I think it's really a great adjunctive therapy to do to just kind of help them really completely relax, release anything that they need to, including, just looking at it from a pure musculoskeletal level, releasing some of the aches and pains that have been, bugging them, and then to be able to move on from there. So, yeah.
It is people, at least in the US, who pick up neurotherapy. It is really a calling, like the people who take the training and then continue to do it. It really is a kind of a calling because it's not the most, it's an injection based technique.
Right.
What inspires you about the medicine more than anything else? Like, what explains your calling to do stuff like this?
That's a good question. I don't know. I always talked about herbal medicine. Like I was probably an herbalist in my last life. I mean, there's been herbalists for like thousands of years. So I'm sure I was one in my last life because it just came so naturally to me. Obviously we have not had neural therapy for more than since, 1905 when protein was invented. So I think what's most inspiring to me is in one of the biggest things is in the doctor's office. So much of our medicine is about symptoms and symptom relief. And really with neural is it's really helping to get to the root cause medicine, which is why is the nervous system stuck in the way that it is? We hear this all the time with our patient histories, like, oh, I always roll my left ankle. I don't know why I always roll my left ankle. Every time I get sick, I get horrible brain fog. I'm not sure what's going on there. There's layers upon layers that happen as we get to the adults where things have not been taken care of, or where we've only had this symptomatic relief medicine because it's never really gotten to that root cause of people healing. So I feel like it very much aligns with being a naturopathic physician and being someone who's looking for the root cause for all of my patients to be able to utilize this medicine. And going back to the central nervous system, I think that there's so much still. I love the central nervous system, or the autonomic nervous system, the fascial structure, and the immune system, and all of these are so intertwined. And medicine has not even touched really like how these things all work together. And I feel like I learn more in my practice from doing neural therapy than almost any papers that I've read, because I watch what people experience and process. And I'm like, oh my God, this is how it's all fitting together in this beautiful symphony in the body. So,
Yeah. I mean, yes, I absolutely agree. Any other last minute things you want our listeners to know about you and who you are and what they'll be listening to coming up in the future episodes?
well, we intend to talk to a lot of really cool people who are doing neural therapy. I think our thought process is to kind of expand it a little at some point to not just be neural therapists. There's definitely other thought processes around the immune system and the fascial system. So I think we're excited to get this started, just to kind of get communication going about how does all this stuff fit together in medicine. Because I feel like I'm sure you and I both listen to a lot of different podcasts and go to different conferences, and people seem to have little tiny pieces here and there, but they're not fitting it together yet. So that's kind of our intention with this, is to bring more awareness around neural therapy, more awareness around injection therapies, more awareness around, the fascial structure and how everything's fitting together, including, any new, studies and things that are coming out. So there's a lot of cool, amazing scientists out there who are looking at kind of the whole process. So that would be one thing. And then I think the other thing is just thinking about us being able to bring teaching, like you and I have been training providers. And it's been amazing to train providers. It's been amazing to have patients who are also going through the process of utilizing neural therapy. And just to be able to hopefully bring kind of more communication about what we're doing out there so that more patients can find what we're doing, because it's been so important with for me, for sure, and I think you too, since we're both equally as passionate about teaching and want to bring this out there, to how this can actually transform patients' healing processes and also just medicine in general and understanding of how things are functioning.
And where can people find our classes?
All right, so we decided for a pretty simple title, which is learnneuraltherapy.com. And so our classes are listed on the website. So anybody who can do injections in their state with their license, and that can be a lot of different people. That can be nurses working under doctors. That can be nurse practitioners. We've had dentists. We've had chiropractors. We've had medical doctors. We have naturopathic doctors all study with us. So there's a lot of different people that can study with us. And then my patient website is it's Dr. Ann Hill. It's basically all spelled out, and ANNEHILL.com.
Great. Thanks so much.
Thanks for having me. Good to talk to
Bye.
you.